Good afternoon. This speech, I thought about it over and over again on what I was going to do it. I decided to do anxiety. I toyed with a lot of fun ideas and a lot of serious ideas. And this one just stuck with me mainly because of this class and some traumatic things that I've been going through in my personal life. So it's kind of maybe therapeutic for me to share this with everyone. Anxiety. Anxiety is a real sickness that occurs with more people than what we think. I have personally struggled with it for about 5 years now, maybe a little longer, but I would say more frequent in the last 5 years due to just personal struggles and things that have gone on in my life within the last couple of months especially, and like I said, over the course of the last 5 years. I was doing some research and actually found out that anxiety does affect about 1.5% of the U.S. population. And this is counting people age 18 and older in a given year. So that equals to about 3.3 million American adults. Many people with anxiety have co-occurring disorders or physical illnesses, which make their symptoms worse. And recovery more difficult. Sometimes after maybe a surgery, anxiety about getting better or, just overcoming everything that maybe the doctor has told you. I know in my personal case, it would be losing people that I love close to me multiple times, having traumatic deaths, traumatic experiences in my life. Involving me and other people. Hard to get over that. Hard to not know what holds and what the future holds, what's going to happen. Just being basically afraid of the unknown. Traumatic times in your life, sometimes we don't think that losing a job or maybe not being able to pay a bill, all of that can just really make a person feel heavy and just feel like a failure and feel like they're not maybe producing or doing everything that they could. And the thing about that is, we try to hide that, and I know personally I did, but it's real, and it's a sickness, and you're not crazy, you're just struggling. And there are so many things that can help you, that can be done. Doing my research here, I've kind of found out that maybe just learning relaxation techniques, clearing your mind, just sitting around and not thinking about something, just clear of everything. Cognitive therapy, behavioral therapy, counseling, dietary adjustments. I know one thing that helped me personally is not eating sweets at night. I love sweets, and I've noticed that when I do eat a lot of sweets, drink a lot of soda, things like that, it just skyrockets. And that just seems kind of weird to me, but that's something that does happen. I know a lot of people say they drink wine or something before bed. Sometimes that makes it worse, but it could make it better. It just depends on the person and what they're actually going through. Breathing techniques. Maybe headphones with soothing music, make that a part of your relaxation technique. Exercise, working out in the gym, releasing those endorphins and stuff in your brain, getting that stuff going and worked up. It's just, there's different things. I know I was a preemie at birth, so I always maybe thought that maybe a traumatic birth could have something to do with anxiety. I did research and referencing to my outline, there were suggestions. A study was done on July 7th, 2015, and there was a study that basically showed that brain scans do suggest that maybe it is hereditary, so maybe not so much a traumatic death or a traumatic birth, but maybe hereditary, being brought on by a parent, a mother, father. it's just there's a lot of different anxieties. I mean, some people have anxiety about death, anxiety about going into a room with a lot of people, anxiety with different animals. It's just a nervous, uneasy feeling in a person, and sometimes people just have anxiety every once in a while. Some people deal with this on a daily basis, and there are different medications that we can take. There's different over-the-counter supplements that we can take. I'm not going to go into all of those because I don't know what's best, because everyone's different. But what I do want people to understand is that this is a real disease. It's a real disorder, and it's something that we really need to talk about a little more. There's a lot of people who struggle from this, and there's a lot of family members who deal with people from struggling with this, and it's ranging from, I'm having anxiety, then I'm having panic attacks. All of these people, including myself, experience all of these things, but we have to find the best treatment that works for us, that works for our family, to where we can get this taken care of. And it may not be something that's ever cured, but it's something that we can handle, we can maintain, we can know how to handle. So when we get into that stressful situation, maybe it's just a lifestyle change. Maybe it's be more organized. Maybe it's get someone to help you. Maybe it's just to say no sometimes. Sometimes we just have to learn to say no and do different things with our life, and kind of prioritize things a little better than what we normally would. I really want to just get out there that it is a real disorder. There's a lot of things that we can do to help ourselves with this. There's a lot of research out there, and I encourage anybody who's going through this, research for yourself personally. Don't allow anybody to pinpoint what you need to do or what you shouldn't do. You find out your symptoms, what you go through, when your anxiety happens, when it's the times that it's at its worst, the times that you're at your best. Do that research, work it out for you, and get that taken care of. And just know that you are not alone in this situation. Thank you.